Good afternoon, everyone. This is the clerk with a courtesy announcement that this meeting is now being streamed live on the internet.
And good afternoon, Julie, if you'd like to check your audio.
Hello, test 1, 2.
Sounds great, thank you.
Thank you.
Good afternoon, Catherine and Vanessa. Please go ahead and check your audio when you can.
Hi, good afternoon. Can you hear me okay?
Sounds great, thank you.
Thank you.
Good afternoon. Can you hear me okay? This is Vanessa.
Loud and clear, Vanessa, thank you.
Appreciate you. Thank you.
And it looks like Sherry, if you'd like to check your audio.
Hi, good afternoon.
Good afternoon, sounds good.
Thank you.
And good afternoon, Supervisor Chavez.
Hi there.
Hi there, hope you're hanging in there okay.
Thank you. I kind of know what one of our colleagues was experiencing a while back.
Yeah.
I forgot medical information, not repeat. Good. Hello, Ms. Ellenberg.
Good afternoon, Ms. Chavez.
All right, we have a big agenda. We're going to keep people focused, huh? All right, let's see. Are we recording already?
Not quite yet. We still have another couple of minutes before 2 o'clock.
Okay, no problem. I just wanted to make sure I didn't talk about anything yet.
We're not recording, but we are streaming live.
Okay, thank you.
Mhm.
If we could squeeze in a mic check for Deborah and anyone else that I missed who came into the room.
Deborah's here.
Thank you.
This is Susan.
Recording in progress.
Madam Chair, we've restarted the recording. It's 2 o'clock, so whenever you are ready. You're still muted.
Great, thank you so much. And I know Supervisor Ellenberg is with us. Let's just give her a minute
Sure.
to come back to us. Thank you. All right, I see Supervisor Ellenberg. So I want to welcome you all to the Children and Seniors Family Committee meeting for Wednesday. And let me just, I'm going to ask for a roll call, please. So sorry.
Good afternoon, Vice Chairperson Ellenberg
I'm here.
and Chairperson Chavez.
I'm here.
Thank you.
Thank you. We're now going to go to public comment, and this is an opportunity for folks to speak to an item that is not on the agenda, but within the purview of this committee. I see no hands raised. David, am I right?
That's correct. There are no hands raised, Madam Chair.
I'm going to close that part of the meeting, and I'm going to move then to item 3, and this is the approval of the consent calendar and changes to the agenda. And Supervisor Ellenberg, do you have any changes?
I do. I'd like to recommend items 4, 5, 6, 12, and 14 for consent, and I'll elaborate a little bit. As you mentioned, we do have a big agenda, and hopefully this can help move it along. Items 4, 5, and 6 were clear annual reports. I just want to express appreciation to staff in submitting those. Item 12 is the county's intern and earn program. The report was helpful, and I appreciate seeing the continued development of the program to add new supports. I was a little bit concerned about the dip in participation rates and would like to just encourage staff to continue to think about how to expand access to the program. I want to just quickly commend the program for their efforts to address food insecurity with the development of the summer feeding element and that partnership. Thank you for all of that. Item 14 is clear and just looking forward to an update coming to the full board in the next few months. And that would be my motion.
Great. I'll second that. And I'm going to add that I also would like to ask that item 13 and 17 be deferred. And let me just explain. So I too, the Supervisor Ellenberg, 4, 5, 6, and 12, I just want to confirm, make a lot of sense. I want to reiterate that staff did a great job. The clearer the reports are, the better for all of us. I want to reiterate Supervisor Ellenberg's point about participation and making it much easier, the barriers lowered, and making sure any child who's been in any one of our systems actually has an opportunity to participate. So if that could come back even in an off agenda, just to confirm what the outreach is and that we've taken that action would be great. Item 13 is a report relating to the implementation of the recommendations from the Young Women's pilot. Although the materials submitted for this item indicate the work is on the right track, staff was non-responsive to the committee direction in August, which I'll just reiterate. We want staff to consult with the Young Women's Freedom Center and report with information and a plan for continued compensated involvement of the Young Women's Freedom Center and participating young moms in the development of the implementation plan for the recommendations that are brought forward in the report. I would also like to defer item 17 to our October meeting and request that Dr. Smith be present for this item. Item 17 is a report relating to the staffing and organizational structure of the Division of Equity and Social Justice. And for Dr. Smith's staff, there was also another item that we'd asked Dr. Smith to be present for. So I want to make sure he can attend the October meeting. And if not, if you could alert my office so that we might work with Dr. Smith to make sure we can find a time that's suitable for Supervisor Ellenberg, myself, and Dr. Smith, so that we're able to work some of these things out in real time and not have to wait to the board meeting. And finally, I'd like to hear item 18 on OCAP out of order immediately following the item 10 on schooling services, as I believe Dr. Dewan from the Office of Education is here to speak on both of those items. Supervisor Ellenberg, does that work for you?
It does. I want to make sure you didn't express acknowledgement of item 14 and just wanted to confirm that that can go on, that my motion included that.
Thank you. And thank you so much. You're right. I missed it. And item 14, I'm very comfortable with that being on consent. What I would like to do is just ask if, I don't know if Sylvia's here, if that will be coming to the full board in October, and if so, at what meeting?
Good afternoon, committee members. Sylvia Gallegos, Deputy County Executive. On the question about Title IX, I don't know yet because we did, and this is good news, since the publication of this report, receive the information that we'd been requesting for a few months from the vendor. And so the reason why I don't know is we are going through the process internally to review this, and we have another meeting today, and we have negotiation meetings set up. What I would offer is we are trying to work as quickly as possible to prepare an agreement to go to the board, but I'm not prepared at this moment until we meet with them in negotiations to commit to a specific date in October. But I want to reassure you, yes, it's my goal to move as quickly as possible.
If I may make a request, Sylvia, is that if we could be alerted to the date in an off agenda, and mostly because I want to make sure that the advocates who really brought the idea forward, just that they know when to come forward. And if it's not going to be heard, if for some reason it can't be heard and you by a particular date, if you would just let us know that too. I mean, just where you're at in the process, that would be great. Okay, thank you. So Supervisor Ellenberg, I'll say this back. We're putting 4, 5, 6, 12, 14 on consent along with our other consent items. We're deferring items 13 and 17, and we're asking for conference that confirmation. Let me make a new word. Confirmation for Dr. Smith to be present. And I just saw you, Greta. Thank you.
And that you want to hear
Supervisor, just
18 after 10?
Yes.
The two, okay, all good.
Thank you.
Super, I just wanted to make sure I clarified I know on item 17, you said you wanted to make sure if that came back in October that Dr. Smith would be there. Is that item 13 is the other item where you wanted to make sure he was present for the item? I did hear the direction on that item.
Yeah, no, it was really on 17 that we needed Dr. Smith. There was another item from a previous meeting. And Greta, I'll have my staff get that to both of your offices.
Okay, I can then confirm that he's available or otherwise arrange a different opportunity to make sure that feedback is received.
Absolutely appreciate it. Thank you. All right, so it's a motion and a second. Let me look to see if there are any comments on that motion. Seeing no raised hands and confirming with Dave Leon that there are no raised hands.
That's confirmed, Madam Chair. I do have one question, if I may.
Of course.
Just to make sure I've got it correct in the minutes, we're holding item 17 to October, and item 13, is that also being held to October?
Yes.
Thank you.
Thank you very much.
Okay, I can do the vote if you're ready for it.
We're ready. Thank
All
you.
right. Vice Chairperson Ellenberg,
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thanks so much. And thanks staff for all the good work on those items. We're going to move to item 7. And this is CDA's incorporation. And I know this is a report from County Council relating to the incorporation of the CDA principles in the county ordinance code. And I'm going to ask who is presenting on this item.
Good afternoon. It's Michaela Lewis from the Office of the County Council.
Welcome.
So we don't have anything to present beyond what's in the report, but are happy to take questions.
What I would like to recommend is why don't we go to the public comment, and we'll give each speaker 2 minutes to speak, and then we'll come back to staff. Thank you.
One moment, please, while we get the timer up. First speaker is Tanmay Malik. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hello, am I audible? Hello, am I audible?
Go ahead.
Greetings, everyone. I'm Tanmay Malik, a student at Santa Clara's International Human Rights Clinic under Professor Francisco Rivera and Professor Britton Schwartz. At the outset, kindly accept my gratitude to the CSF committee. I have two submissions to make before the committee. One, that the proposal is a deviation from successful precedents, and two, that it creates unwanted bureaucracy. International Human Rights Clinic has been engaged on multiple occasions with the county officials, such as in preparing a report for the women experiencing homelessness, which was published in 2018. With regards to my first submission, it specifically, we believe that Santa Clara County has shown admirable commitment to CEDAW and gender equality, but the proposal does not meet our identified priorities. Considering the example that have been set forth by other counties like San Francisco, Los Angeles, and San Diego, as well as the Santa Clara County's Commission of Status of Women proposal of a standalone CEDAW ordinance, as noted on page 7 of the present agenda, the proposal does not follow the successful examples. I believe the proposal, as opposed to the few examples being the very first from San Francisco or the latest one from San Diego, lacks provisions about A, funding, B, action plans, C, institutionalized gender audits, D, oversight committee to fulfill the county's goal towards CEDAW ordinance. The second submission on my behalf is that the proposal creates more bureaucracy. Implementation of the current proposal seems discretionary in nature and centers on CSW in an advisory capacity, which then makes recommendations that are not binding, which would have to be again considered and implemented by the Board of Supervisors. Such endless cycles of bureaucracy, I believe, will only cause harm when they were supposed to be intended to do good. Lastly, I thank you so much for presenting me this opportunity, and thank you to the County Council for preparing the draft amendment. I also appreciate the leadership from Supervisor Ellenberg.
Next speaker is Lisa Little. You have 2 minutes to speak. Please go ahead. Lisa, I see that you're unmuted, but we can't hear you. Oh, go ahead.
Okay, hi, this is Lisa. Yes, I'm as a former member of the CEDAW task force and representing the Commission on the Status of Women, having worked in volunteering there for over 5 years, I can say that this is not what we had recommended and is really not ideal. In fact, it's just not acceptable for CSW, which right now only meets 6 times a year, to be trying to, and not having committees and barely having ad hocs, to try to kind of put in our, as an amendment. That's just not really meaningful for CEDAW. It doesn't respect the UN commitment for our county to stand up as a progressive county, to uphold the principles of CEDAW with gender-based analysis. And I really believe strongly that DESJ, since it oversees several offices, including the Office of Gender-Based Violence Prevention, OWP, the racial disparities, and also justice, all of those areas are under DESJ, and they really should be in charge of having this standalone ordinance with staff so that we can have the gender-based evaluations of all the different areas, and also use them to help work with folks like Santa Clara Law and other outside independent evaluators for our gender-based analysis. I really believe that we can be much more effective with a standalone ordinance. It's just not appropriate to try to hide the principles under an amendment in CSW. So I thank you for your consideration and really hope that you think strongly about how much we've been working on this and where we're going, so that we can make a real difference for the women and girls in the county. I appreciate your time.
Next speaker is Britton Schwartz. You have 2 minutes to speak. Please go ahead. Britton, are you there?
Yes, am I audible?
Go ahead.
Thank you. Thank you so much for the opportunity to present comments. I wanted to support the comments given by the previous 2 speakers. I am the Deputy Director of the International Human Rights Clinic at Santa Clara Law. And as Tgmb mentioned, we have been very involved in supporting the county's admirable leadership on implementing CEDAW principles and identifying the county's priorities around gender equity. The county has invested a lot of work and a lot of resources in assessing CEDAW and how that the principles of CEDAW map onto the needs of Santa Clara County's women and girls. And this proposal, while it's a good start, it does not get us to where we would like to be in terms of fulfilling those goals that, again, a lot of work and a lot of resources have gone into identifying. as the previous speakers have mentioned, it's really vesting all of that oversight in an advisory body. And while I think there is a lot of value in having an oversight body monitoring and giving advice on the county's efforts to implement the principles of CDOT, ultimately there needs to be a real institutional mechanism to implement CDOT principles on an ongoing and sustained basis with action plans and dedicated funding and institutionalized gender audits so that the county can really have a plan of work that continues into the future to meet these identified needs of our women and girls and also to accommodate future priorities that are identified as time moves forward. I really appreciate the leadership that Supervisor Ellenberg and Supervisor Chavez have had on these issues, as well as the work of the Commission on the Status of Women and the Office of Women's Policy. And I think all of the work that has been put into this would be best served by expanding this proposal into a standalone CDOT ordinance. And I hope that this committee will continue its leadership in this area by directing County Council to do so. Thank you so much for the opportunity.
Next speaker is Meg Beeson. You have 2 minutes to speak. Please go ahead.
Am I audible?
Go ahead, Meg.
Okay. Thank you. Thank you so much. In addition to my colleague Tamme and Professor Schwartz's comments, we would like to also submit that while we agree that it is important to have an external body of experts such as CSW play an advisory role, in addition, we believe that the proposal should include mandatory funding and implementation mechanisms. The way that the draft ordinance is currently written and presented, there is no definable structure that would ensure meaningful implementation of CDOT principles in Santa Clara County. A comprehensive CDOT ordinance would remedy this because it would institutionalize strong implementation mechanisms where issues could be regularly attended to. Through the 2017 ordinance, the county showed its commitment to CDOT principles and identified its priorities for achieving gender equality. And to address these priorities, the county would best be served by creating a binding implementation mechanism that stands the test of time. I would also like to extend my gratitude to the county for wanting to address these issues and its dedication to gender equality. Thank you very much.
Next speaker is Tracy Windgrove. You have 2 minutes to speak. Please go ahead.
Hello, my name is Tracy Windgrove, and I am the chair of the board at the YWCA Golden Gate Silicon Valley. And we have been active in the CDOT task force. And I was very surprised to see the County Council's recommendation that CDOT not be adopted by the council. As previous speakers have said, I echo their sentiments that the current proposal is insufficient, and I strongly recommend that the Board of Supervisors consider adopting CDOT as opposed to in opposition to the County Council's recommendation. Thank you.
Next speaker is Urbish. You have 2 minutes to speak. Please go ahead.
Thank you very much to Board of Supervisors. Again, wanted to emphasize the importance of what it takes to contribute and as a part of advising body with the Senior Child and Families Commission towards the Santa Clara County, as well as providing insight on that, what has been transpired along the side of a pandemic and going towards endemic and contributing to a different capacity by the Board of Supervisors as well as county staff and county council in providing the services on numerous issues as related to the gender equity, racial discrimination, social justice, as well as the juvenile justice, and as well as the youth development. And on a numerous occasion, as it has been mentioned also about the LGBTQ rights, though it is to be mentioned, as it has been mentioned by the previous speakers and echoed that that the Santa Clara County itself is a diverse community itself, and though the demographic which differs from the San Francisco County, San Diego County, as well as Sacramento County, it is equally important to note here that sometimes the Board of Supervisor has, and as well as the county has done the work in lieu of and in the benefit of a citizen, where it becomes a testament for the county, and those prejudices has been taken as the evidences of that, what has been performed as those testament within the county. Along the side, it is equally important to note that some of the counties which is implementing the similar programs are completely different community itself, like a San Francisco County, which has a completely different legislation than the county of Santa Clara, which also allow a certain set of a sanctuary city laws to be prevailing within San Francisco County. But whereas the Santa Clara County is completely diversified community itself, which is providing the international humanitarian welfare as well as taking care of the human rights as well, and to make sure that performing the duties where the greater good is in hands of itself. So thank you very much for consideration of comments.
Next speaker is Leslie Corsiglia. You have 2 minutes to speak. Please go ahead.
Hi, good afternoon. My name is Leslie Corsiglia, and I really appreciate all of the comments that have been made so far by previous speakers. And I thank you for the opportunity to speak this afternoon. I sit on the Commission on the Status of Women, and I am a resident of District 2. I am new to the topic of CEDAW, though I've supported the ERA since I was in college, and I still have my T-shirt, and really support all efforts that we can make to ensure that women have rights, they have equality, they have equity. And I ask today that we move forward with the adoption of a permanent standalone CEDAW ordinance. While I appreciate the work that the county and county staff has done, in my limited experience with the commission, I really don't see that adding CEDAW to the commission's responsibilities will be effective. We really have very, very little opportunity, as Commissioner Ladau said earlier, to do any work, and we're not meeting often enough. And so I'm very hopeful that that you will consider taking action to move to the next step beyond the one recommended today. Thank you very much.
Next speaker is Jenny Higgins. You have 2 minutes to speak. Please go ahead.
Hi, thank you. I appreciate the efforts that Supervisor Chavez and Ellenberg have done to support CEDAW, but I'm sorry to hear that we are facing yet again another challenge in passing a straightforward and meaningful CEDAW ordinance in Santa Clara County. While I do appreciate the addition of the CEDAW principles into the CSW ordinance, it is not meaningful or sufficient for the county's commitment to CEDAW, nor does CSW offer the resilient oversight necessary with its changes in leadership, medium frequency, and true power to act. The time has been long in coming. It's been over 23 years since the first CEDAW resolution supporting national ratification was passed in Santa Clara County. Since then, there have been many attempts in the intervening years to create a CEDAW ordinance that stands alone, which has brought us to the point of where we are today. I further believe that what Santa Clara County does to codify gender equity within county operations will have a real and lasting impact here in Santa Clara County, as well as a shining example for cities and counties around the state of California and across the nation. We need a standalone CEDAW ordinance. And once a standalone CEDAW ordinance draft has been provided, I hope there'll be opportunities to have more discussion in greater detail. Thank you.
Next speaker is Francisco Rivera. You have 2 minutes to speak. Please go ahead.
Thank you. Good afternoon. My name is Francisco Rivera. I'm the director of the International Human Rights Clinic here at Santa Clara Law, and thank you so much for giving us the opportunity to participate. I just wanted to, mention some of the history of our involvement here. We worked very closely with the Office of Women's Policy, from 2015 to 2017 in the actual drafting of the previous ordinance. And afterwards, after the ordinance was approved, county authorized funding for us to work again with the Office of Women's Policy to ensure, that we implement a gender analysis of homelessness in the county. So we were the co-authors of the Women Experiencing Homelessness report that county published in 2018, and that's the kind of gender report or gender audit that we're hoping we can see from this ordinance moving forward, but in a more institutionalized fashion and not on an ad hoc basis, looking at each topic separately. I want to mention that, and to put ourselves at the disposal of the county. One more point that I wanted to mention is I'm not really sure I understand the procedure suggested by council in this proposal. I've looked at it. I don't really understand the rationale behind it, but it seems to be something that is not in line with what we've suggested in the past when we discussed the CEDA ordinance 5 years ago. But I do want to put ourselves at the county's disposal, to continue to provide, our expertise in international human rights and our assistance if it's needed. We have a lot of students locally here in Santa Clara who are willing to, roll up their sleeves and get to work to get this moving. So thank you for the opportunity to continue working with the county. Thank you.
And that concludes our speakers.
Thank you. Thanks very much. Supervisor Ellenberg, do you want to start or would you like me to?
Chair's prerogative.
Oh, no, go ahead, Susan. I know this is something you've been focused on and you served on the Commission of Status, so I'd love to get your thoughts.
Yeah, thank you. We've heard very, very clearly for quite a while the advocacy for a standalone ordinance. And what I would be interested in seeing administration come back with is a standalone ordinance, of course, would have impact for all of county operations. And I'd be interested in having staff come back with recommendations for the board's consideration for a framework to incorporate the CDOT principles, such as would be included in a standalone ordinance, into the county's operations. And the report should include an evaluation of how training, tools, enforcement, and reporting can be used to ensure that the county is embedding CDOT in the way that we do business. And considering that I don't have a sense of the impact on our operations, I want to make sure that that is part of what we review when we have an opportunity to bring this back.
Great. I want to see if staff has any thoughts about this that they would like to respond both to the public speakers or to what Supervisor Ellenberg just requested.
Yeah, absolutely. I think one piece of clarification that I want to provide is what the recommendation is, which is the proper form for regulating county operations is through a board policy, which we would of course be happy to bring back to flesh out some of those details. And that tool is used consistently by the board to give direction and stringent requirements on a number of things. And the example that comes to mind is board policy 3.54 that gives direction on how the county should interact with U.S. immigrations and customs enforcement. That's the proper form for regulating and standardizing county operations. So we would, of course, be happy to bring that back with more fleshed out details.
So let me make an observation, and then Supervisor Ellenberg or Michaela, either of you just jump in. This has felt a little out of sync with the CDOT task force from when they finished their work to the number of times it's come back. And what I'm having a hard time understanding is the reason there's a delta in approach, a genuine misalignment or a disagreement about what we're trying to accomplish, or is it the tools that are being recommended by staff? And Michaela, maybe you could give me your perspective on it since you've heard the speakers.
Yeah, I'm happy to. It sounds like the delta is between the tool that would be used, whether it's a standalone ordinance or not, that from our county operations would not be the proper form. We do have differences from other counties. So I definitely heard the reference to San Francisco. That's the mechanism through which the exclusive mechanism for the board to operate. It's different for us. As you all know, the board gives policy direction and operational direction through the board policy manual. So I think that that's part of the delta, less about the substance.
So let me just share what my overall concern is. My overall concern is that this has come back to us a few times and not been remedied. And so I'm worried that that we're not really hearing the CDOT task force, and frankly, that because of that, we're not getting the kind of recommendation that I think it would be very clear in terms of how we're going to proceed. So if Supervisor Ellenberg, if I hear what you're saying, you're asking for the staff to come back with the framework that would go in the policy manual and a standalone ordinance. Is that accurate?
Let me clarify something that you just said first, and then that might help me. What I am interpreting from all of this is not that the advocates haven't been heard, but that administration has heard them, but continues to recommend a different path forward, ostensibly to achieve the same goals. And Michaela, what I would like to hear, because I do understand that you agree with the principles, you want us to get to the same place, and it's the mechanism of implementation that's problematic. Could you maybe explain to us what the downsides or the problems you envision with a standalone ordinance, and why there's been reluctance to go that way, other than the fact that it's not our usual way of doing business? Is it improper? Are there problems with it that we're just not seeing? Because I don't want this to keep coming back. I want to really have an understanding. If we're not going to get to the standalone ordinance for reasons that are fundamental in our county, then I want us to just be clear that that's where we're going to land. But I want to understand really if we cannot get ourselves to a standalone ordinance, what the actual
impediment is.
Thank you. Impediment. And what problems it would potentially cause for the county that we're not thinking through.
Yeah, thank you. Well said.
Yeah, I mean, definitely. And we can definitely provide more information kind of confidentially or offline, but within this setting, the ordinance code is not the format for how we're regulating county operations. That is handled through the board policy manual. That is the absolute appropriate tool, and we can provide more context kind of confidentially offline as well.
I wonder how, and I do want to respect that, where I think we're not going to be able to bridge the gap, though, is if we can't explain publicly in a defensible way why we cannot do the standalone. We're going to continue to have this friction when in reality we all want the same work to be done. Greta, I saw that you turned your camera on. Is there something you can add to help us? I'm not obviously, I mean, I hope it's obvious. I'm not trying to push us toward things that are matters of law and have to be discussed in closed session, but I think we owe some public transparency and accountability to why we keep pushing back against something that is clearly very desired.
Sure. And, I will just apologize that I'm coming late to this specific conversation because I'm just taking on this role and I've not been party to some of the work in my previous role that was done in the county counsel's office on this, but I can speak more generically, putting aside CEDA specifically, why there's a strong preference on the staff side in a number of contexts to have direction from the board to staff about how we operate as a county embodied in the board policy manual as opposed to in the ordinance code. And one very simple, straightforward reason, there are many, is that the default in the ordinance code is that a violation of the ordinance code is a misdemeanor. We often get concerns on the part of our staff about the notion, and I think you've heard this in certain other contexts, that where direction to staff comes in a form that may attach to it certain criminal penalties, that there's just a lot of fear of that context as opposed to the normal mechanisms that we would use to ensure staff compliance with policy direction or operational direction. So again, I have not assessed how that would play out specifically in this context, but the more generic answer to the question of why the default preference operationally is to ensure, among many reasons why, direction from the board on how county staff are to conduct themselves and pursue operations generally being a board policy. That's one of many reasons that I just put out in case it's helpful in this context.
Greta, that is very helpful. And for operational purposes, could we create, or is that what you did create, a board policy that affects all of the same direction that would be in an ordinance?
Yeah, that's generally what the preference has been, to have exactly the same rules and requirements applied to staff through the mechanism of a board policy, where the enforcement would be the traditional mechanisms you'd use to ensure compliance with very important county policies that we do routinely ensure compliance with. But that's structurally why we prefer that mechanism, among other reasons.
Okay, thank you. That really is helpful. I do want to emphasize then that my direction was not for a particular format, ordinance, or board policy, but what I really just want to understand is what a framework to incorporate CEDAW into the county's operations would look like. Again, being curious about training and tools and enforcement and reporting that can be used to ensure that we are embedding CEDAW into the way we do business. And again, I don't know if this is a high or low impact policy / ordinance, so I'd like that information to come back.
Absolutely.
Supervisor Ellenberg, may I make a recommendation? And that is, instead of just receiving the report, what I would like to do is, team, let me know if this is appropriate. I'd like to continue the item. I would like an off agenda or a closed session, whichever, Michaela, you and County Council and Greta think is most suitable, so that there's a much deeper understanding of the implications relative to the CEDAW standalone ordinance, just specifically, and what the alternative framework is relative to what Supervisor Ellenberg just talked about, that policy framework. That would be, a continuation with that, with the ability to have the conversation with us in the most appropriate way, so that we understand when it comes back that we're not being euphemistic, but we are in fact very deliberate about the consideration before us. And then the other thing is that this is what I meant, Supervisor Ellenberg, about not being heard. I didn't mean to make it sound like our staff was being non-responsive, but I do find that there has been a delta between the task force members and the staff for a while. And I hadn't attributed, frankly, to I think Michaela's point about the application of the issue being more complex, perhaps, in the way that we're thinking about it. And I do want to just say that I think our staff does a really good job of thinking about every eventuality, which I appreciate. That said, what I am still sort of struggling with is, irrespective of whether or not the ordinance is standalone or embedded somewhere else, and irrespective of whether or not we're using a planning document with, a policy document to say go forth, I am still concerned about the application of the elements of it specifically. And what I mean by that is that when we looked at equal pay, this was many years ago, and Greta, you'll probably remember this, is that when we started down the path of looking at equal pay, we had a number of components to that, including one that was going to include an analysis of our contractors. And to my knowledge, we still don't have the tool that we need to be able to do an analysis of those contracts to determine whether or not all of our contractors are in fact paying women the same that they're paying men. I think what we know is that that's an expectation from them, but we don't have a tool that actually can confirm that. We don't do audits. We don't do any of the things that we thought we were going to do initially. So when I hear what Supervisor Ellenberg's saying, I'm thinking, okay, that makes sense that we want to have the policy framework, the ordinance, and the tools in place. And where we don't have those tools, why are they missing? Because the importance of places like San Francisco and Santa Clara County taking these kinds of actions is that we can create a framework that both the public and private sector can use. And where I feel like we're this far apart is that we haven't sort of jumped all those hoops. And I don't know, because there was a CDOT task force and we have the Commission on the Status of Women, if what this is requiring is some sort of a working group that's got maybe a couple of those task force members, maybe a couple of Commission on the Status of Women, leaders of some of our major departments, maybe somebody from procurement actually sitting down with county council to go through exactly what Supervisor Ellenberg is requesting, so that what comes back is not just well-researched, as you always do that work, but really well-informed as to what's working now and what's not, and therefore why the framework that's being brought back is the most effective one.
No, that makes a ton of sense.
Okay. Supervisor Ellenberg, are you comfortable with that?
Excellent.
Okay. All right. So I'll add that, Supervisor, to your elements in your motion. I think I took in what you were saying and just added a couple components to it. And if we could take that as a motion, and Greta will work through you and council to figure out what departments, who's taking the lead. Obviously, you make all those staffing decisions. And then if we could get we'll continue it with the report back on the framework we just laid out, so that when we have the next discussion, it'll be about the framework, so that we understand the right pathway, and we will have been informed either in closed session or through a confidential communication about the decision you're making, so that we can talk that through before you do too much more work.
That sounds great.
Okay, good.
Thank you.
All right, that's a motion and a second to continue with that direction. Dave?
Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thank you so much. Thanks all. Very good discussion, and thanks for all the feedback. All right, item 8. Supervisor Ellenberg, I believe this is an item that you requested. So thank you for that. This is the LGBT Older Adult Community Advisory Working Group, and I think Sarah is going to be presenting.
That is correct. And good afternoon. Yeah, thank you. Good afternoon, Chairperson Chavez, Chairperson Ellenberg, and committee. My name is Sarah. I'm the manager for the Santa Clara Office of LGBTQ Affairs, and thanks for the opportunity to present our LGBTQ Older Adults Community Advisory Working Group. In this, you will find in the report the 2021 LGBTQ+ Older Adults in Santa Clara County Executive Summary, the presentation deck for the LGBTQ Older Adult Community Advisory Working Group kickoff back in June 2022, the LGBTQ Older Adult Community Advisory Working Group charter, and this presentation deck. To give more of background and context of this work, in 2021, the county sponsored an LGBTQ+ Older Adults in Santa Clara County report to better understand the health and well-being and experiences of diverse subgroups of LGBTQ+ adults age 50 and older living and or working in Santa Clara County. Significant well-being and health findings from this report include more than 1/3 of participants reporting serious thoughts about suicide or self-harm, 4 out of 10 participants reporting being treated unfairly or discriminated against within the past 24 months due to being perceived as LGBTQ+, with most common experiences of discrimination occurring while accessing medical or health services, aging services, or other social services. And 2/3 of participants report that they are lacking companionship or feel left out of social gatherings and or feel isolated. Now, in June 2022, the Office of LGBTQ Affairs convened an LGBTQ Older Adult Community Advisory Working Group as a top priority to address the challenges and services needs revealed in this report. The group consists of 18 members, including 7 local LGBTQ+ older adult community members, 7 County of Santa Clara employees from agencies such as Social Services Agency and Public Health, and 4 individuals from LGBTQ+ service providers and community-based organizations such as SourceWise, LGBTQ Wellness, Rainbow Rotary, and Avenidas. Outcomes from this initial meeting include the need for establishing a group charter, an agreed upon group meeting time of every first Tuesday of the month, and general feedback on current LGBTQ+ older adult services in Santa Clara County. In July 2022, the group met virtually to develop an LGBTQ older adult community advisory working group charter to outline the group's vision, mission, and values. The group's vision is for all LGBTQ+ older adults to be provided with opportunities to live healthy and fulfilling lives. The mission is to ensure Santa Clara County continually progresses as a safe and affirming place for LGBTQ+ older adults. Santa Clara County aims to be an innovative pro-aging model for other jurisdictions through its inclusive policies and services for LGBTQ+ older adults, where they have access to nurturing and socially inclusive environments, can affordably live and connect with community, and receive culturally competent supportive care from services free from discrimination, bias, stigma, and abuse, and are empowered and encouraged to learn and develop in ways that reflect their authenticity and best selves so that they may thrive. And finally, the group's values were for the just treatment of LGBTQ+ communities and compassionate care in service to LGBTQ+ older adults. The work is centered on respect, resiliency, self-determination, and belonging in the LGBTQ+ older adult community. Current work includes recommending the following work plan priorities and outlining activities that support the health and well-being of Santa Clara County's LGBTQ+ older adult population, enhance access to aging and health services, and build upon the social support and resources for the LGBTQ+ older adult community. These priorities include expanding culturally relevant training programs for frontline aging, healthcare, and housing providers, dedicating ongoing funding to provide tailored social activities, services, and programs for LGBTQ+ older adults, promoting intersectionality and agency to center values of just treatment, respect, resiliency, self-determination, and compassionate care, and developing an LGBTQ+ community volunteer registry to identify community members who are available and able to perform services to benefit the well-being of older adults. That concludes our presentation, and we are open to any questions from the committee. Thank you.
You're muted, Madam Chair.
Thank you. Thank you very much, Dave. Is there anybody from the public who would like to speak on this item?
I don't see any hands, Madam Chair.
Thank you. I'm going to close the public hearing and I'll go back to the committee and I'll turn to Supervisor Ellenberg.
Sarah, thanks so much for the report. I'm curious to know how the work of this commission becomes actionable throughout the county. Do you anticipate the commission making recommendations to departments, whether it's the Office of Supportive Housing, the Office of Aging, Older Adults, sorry, I forget what that's called, Diana Miller, or other avenues? I want to make sure that the work is not kept encapsulated within this commission or within this community so that we really can be fully integrated.
Yeah, absolutely. So right now we're developing our work plan, and with the work plan coincides a lot of the strategies behind expanding culturally relevant training programs, dedicating sustainable funding, and developing an LGBTQ registry. For example, we're working closely with Avenidas and looking at the services that they provide and try to amplify it throughout South Bay, not just in North County. Other things that we're looking at is a multilingual approach to outreach materials to provide to older adult service providers that serve LGBTQ communities, whether they know it or not. Other things, also making intentional marketing efforts, drafting a pamphlet to inform on some of the resources that are out there. And specifically with the volunteer registry, I think that one was really important. Being able to connect volunteers to senior LGBTQ plus older adults that need additional assistance or support. And it's through the work of the network that we have through this community advisory working group that we're able to do that. So yes, there will be recommendations, but right now the phase that we're in is finalizing the work plan, which should be done next month.
Got it. Thank you very much.
You're welcome.
Excellent. The thing I just wanted to lift up is I thought the idea of the civic and volunteer opportunity was so fabulous. I think everybody who read it, that caught their attention, because I think back to Supervisor Ellenberg's point, it really is about belonging and this connectivity, and what better way to be connected than serving others. So thank you for that. With that, we'll take an action to receive the report.
You want a motion to receive the report? Or we don't?
I don't think we actually okay, let's move on to the next item then. But before we do, what I want to do is I want to defer items 15 and 16, and I just don't want to keep the staff and get us all the way to the end, and then we can't hear their items. So for 15 and 16, do I need a motion to defer those?
Do you want to defer them or accept them on consent? Can we add?
I need to talk about both of them.
Okay.
Yeah.
Okay. I'm happy to move that we defer those items.
Thank you. I'll second that. Dave, can you vote us on that?
Vice Chairperson Ellenberg?
Yes.
And Chairperson Chavez?
Yes.
Thank you.
Thanks. I just didn't want to keep staff unnecessarily. All right. And then we're going to go to item 9, and this is recruitment, retention, transgender, non-binary, gender expansive employees. And I think, oh, good. Seriously, I'm still here. Okay, great.
So we're doing it back to back today. So good afternoon, committee, again, and thank you for the opportunity to present on our transgender recruitment and retention. In this file, you will find the items include the Santa Clara County Trans Employment Research Study Executive Summary, the Trans Needs Assessment Executive Summary, a transgender recruitment and retention overview, and this presentation deck. In this presentation, we'll be covering the transgender recruitment and retention updates, as well as findings from the reports such as the Santa Clara County-wide Trans, Non-Binary, and Gender Expansive Survey, findings and recommendations from the Trans Needs Assessment, and transgender, non-binary, and gender expansive outreach efforts. And please note, during this presentation, I'll be using the acronym Tgmb or trans when referring to transgender, non-binary, and gender expansive people. The goals of this initiative is to increase outreach and opportunities for Tgmb applicants, employees, and vendors, and strengthen retention rates at County of Santa Clara by creating an affirming workplace environment for transgender, non-binary, and gender expansive people to thrive. Our office's strategies in achieving this goal are to invite trans community input to address ongoing challenges and barriers, advance training and administrative guidance to ensure Tgmb people feel safe and welcome in the workplace, and expand programs and hiring efforts to be inclusive of Tgmb people with a specific focus on transgender women. Since the March 24th, 2022 Children, Seniors, and Families Committee meeting, work that has been done include the completion of the Santa Clara County-wide Transgender, Non-Binary, and Gender Expansive Report, the completion of the Transgender Needs Assessment Community-Based Participatory Research Report, availability of new Skillsoft web-based training, compliant short LGBTQ plus protections against discrimination and harassment, and SCC Learn for all employees, increase participation in Trans Can Work inclusive workplace trainings, and exploration of an intercultural competency coaching pilot to support leadership training and engagement with county inclusion goals, especially in regards to trans, non-binary, and gender expansive cultural competency. Regarding the Santa Clara County-wide transgender, non-binary, and gender expansive report conducted by research firm Community Marketing Insights, here are some key findings and recommendations we'd like to highlight. From November 2021 to April 2022, a total of 234 Tgmb identified community members who live or work in Santa Clara County participated in the research project through an online survey, focus groups, and in-depth interviews. Most participants, about 86%, live in Santa Clara County, while others were from neighboring counties, but working in Santa Clara County. The age range of the participants was 18 to 70, representing diverse racial and ethnic groups living in the county, including 25% Asian or Pacific Islander, 24% Hispanic or Latinx, 11% Black, and 38% white. And although half of the participants, around 46%, had a bachelor's degree or higher, only 44% of participants were employed full-time and 12% were unemployed. Through this research project, we can identify some of the challenges and barriers Tgmb people face, either in the workplace or when seeking employment. For example, many participants were not aware of the programs that exist for Tgmb people in the county, including the existence of an Office of LGBTQ Affairs, as 38% of respondents viewed the County of Santa Clara as being responsive to the needs of the Tgmb community. 43% of participants reported difficulty finding work in their field in Santa Clara County, and 3 out of 4 participants attributed the difficulty to their Tgmb identity. 70% of participants said that they have experienced anti-Tgmb discrimination, and many participants expressed that they suspected discrimination but couldn't prove it. Over 80% of participants have experienced microaggressions at work by coworkers and supervisors, including being referred to by the incorrect gender pronoun verbally or in written communications. 27% of participants felt that they were frequently rejected by potential employers without explanation, even when they are clearly qualified. And 1 in 4 have been directly told that they would not be hired because of their gender identity and or expression. And finally, only 24% of participants had reported anti-trans discrimination to a supervisor, manager, or human resource department. Even during the job application process, nearly all participants have filled out job applications did not include gender options beyond male and female. And 64% avoided applying for some jobs because of concerns that they would not be accepted as a Tgmb person. Based on input from participants, Community Marketing Insights identifies several recommendations for County of Santa Clara in supporting Tgmb employment experiences, including increased awareness and outreach budget to promote employment programs, resources, and opportunities that benefit Tgmb community members, and increase the visibility of trans people. Tgmb employment public awareness campaigns to highlight trans community members who have been successful in their career paths and could direct the community to existing and new employment programs. Enforcement of anti-discrimination laws and policies to ensure Tgmb people are protected from illegal termination, discrimination, harassment, and or violence. And gender inclusion policy or Tgmb employment rights policy to ensure that all county spaces, services, and resources are trans affirming and inclusive. Now, switching gears just a little bit, we'd also like to highlight key data points and recommendations from the Transgender Needs Assessment In 2019, researcher Danielle Castro conducted a transgender needs assessment community-based participatory research. The assessment was conducted through one-on-one interviews, small focus groups, and written responses. A total of 276 trans individuals participated in the assessment. Of those that were currently or formerly employed, 25% of trans employees had experienced gender-based discrimination by their employer. Of those 25% that experienced discrimination, only 5% felt safe enough to file a complaint to the proper channels, and most ended up being terminated or left their job due to ongoing discrimination. Regardless of reporting or not, 99% of all trans employees discriminated against were fearful of retaliation, and even 2% of employed participants experienced physical violence while at work at their employer. Based on the input from assessment participants, Castro identifies several community-informed solutions in fostering safe spaces and environments free from transphobia for all workers. Those recommendations include educating all workers about Tgmb equal rights and cultural humility, which include topics such as implicit bias, gender-inclusive policies, inclusive language, pronoun usage, and best practices for inclusivity in the workplace. Enforcing national, state, and local laws and policies that protect Tgmb people. Hiring Tgmb people for high-level positions beyond entry-level positions and support the ongoing professional advancement of trans people. And providing employee benefits and resources that support Tgmb people, including health insurance that covers gender-affirming procedures, trans-affirming mediation and counseling services, access to legal services, and information specific to the needs of the community. In addition to creating an affirming workplace environment for Tgmb people to thrive, transgender recruitment and retention calls for continuous engagement with Santa Clara County's Tgmb community and expanding support. Both reports recommended that county employment programs include job-specific training, trans employment workshops, mentorship programs, self-employment workshops, professional career counseling and coaching, and cultural competency education for employers. In expanding our reach, the Office of LGBTQ Affairs is collaborating with the Human Resources Diversity, Equity, and Inclusion Sourcing team to highlight county job opportunities and explore opportunities for an LGBTQ career event in 2023. The Office of LGBTQ Affairs is also continually inviting local Tgmb community members to a community-led roundtable session in providing feedback on job search support, career coaching, and networking opportunities to help inform a potential transgender economic empowerment pilot program. And finally, our office is assessing the programmatic, logistical, and budgetary considerations for a potential transgender inclusion fellowship. Through our experience and involvement with programs such as the County Government Fellowship Program and Public Allies, the Office of LGBTQ Affairs staff have learned how to nurture prospective talent and build talent capacity from our past 3 fellows. That concludes our presentation, and we are open to any questions from the committee. Thank you.
Thank you. Let me first start to see if there are any public speakers on this item.
Doesn't look like we have any hands up, Madam Chair.
Great, thank you. We'll close the public hearing and come back to the board. Supervisor Ellenberg, would you like to start?
I would. Again, Sarah, thank you for this report. I have to say that the June 2022 study of the TNBG employment was pretty disheartening to read. The survey had very similar results and conclusions to the one that was completed in 2019, 2020. For sure, the pandemic slowed progress on improvement for the TNBG community, but some of the conclusions are still really of great concern to me. We are a major employer. The county, in fact, is the 3rd largest employer in the county, and we should be a leader in working with the TNBG community to change this pattern of discrimination. The executive summary lists 6 recommendations. So I would like to make this direction, please, that no later than the December meeting of CSFC, that the Office of LGBTQ, please prepares a report with an action plan and the resources that may be needed for implementation of those recommendations. I really want to make sure that this report doesn't sit on the shelf. Sarah, I'm sure you are in agreement there. In order to achieve equity, it is really essential that we have real data, and the lack of the SOGI data is really a major stumbling block for the county. So I would also direct that ESA come back to CSFC no later than our November meeting with a report as to the status of how the county is going to go about obtaining SOGI information for county job applicants. And in that report, I'd like to see information about the actual statistics regarding how many TNBG applicants there were for county jobs, and the results, meaning whether they were hired or offered jobs within the last 12 months. And those 2 pieces of direction would be my motion.
Thank you. I'm happy to second that. I have just a couple of other issues I want to get your thoughts on. So first of all, thank you for the report. And I think, to Supervisor Ellenberg's point, having the information is the best way to get better. So appreciate that, and appreciate this is not anyone blaming. It's really saying, okay, here's our baseline. We haven't gone above our baseline, even though we've had some activities. Now, what needs to happen next to address that? So I just want to reinforce what Supervisor Ellenberg was requesting. I have an additional request, and this actually, Sarah, may be less for you and a little more for Greta and to John Mills. And that is that, what this really elucidates is that we have been very focused on training for many, many parts of our organization, but the kind of linchpin training that I am interested in us better understanding how all of this is being integrated in is with the managers of the county. And I feel like we often promote people, they're very good at their jobs and they're good people, but the tools to be able to manage in an open, inclusive way is really, I think, more challenging than before. In part, we want to make sure we're following the law. We also want to make sure we're creating an environment where everybody belongs. We also need to make sure the public's work is being done. And we're asking our departments to make sure that that we're hiring folks who may be needing more support in their work, reentry clients, peer mentors. And I am just wondering, I don't see John Mills. And I'm just wondering, Greta, have you been a part of any of these discussions that are really looking at it? Oh, and then remote work. I mean, just to make it all more complicated. Any discussions about what we can do to really support managers in managing in this environment?
I am very excited to engage those questions. I'm just, as part of my new role, entering some of those conversations and really just also trying to learn everything that we have in place. So I think I'm at the very beginning stages of those questions, but I certainly agree with the sentiment around both the many different dimensions that we need to strengthen our managerial capacity and the level of support that it requires to really grow folks' skill set. Certainly, it's the case that we have a lot of people who promote exactly as you said, because they've been really excellent at the level of work they've been doing previously and need a lot of support to be the kind of really high quality managers who also are very capable of supporting an increasingly wonderfully diverse workforce. But I am early on in my foray to kind of understand exactly where we are on that journey.
I would just make a request that perhaps by the December meeting, we just even get from Greta, from you through, or John, but through you, the training that we currently provide and how it's inclusive of the work of GARE, of the Office of, of the Office of Social Equity, and And then how many people actually go through the training? And then once somebody is promoted, how much time do we actually dedicate to training and the evaluation that they get on their capacity to train? And I mean, on their capacity to manage. And I partly mention this because in other parts of the organization, we'll talk about this in a bit, that delta of training is actually really felt in pretty dramatic ways in everything from even how we handle I'm forgetting what we call it when worker accommodations, reasonable accommodation for somebody, that depending on the department we seem better or worse at it, and that to me seems more of a skill set and resource question than anything else. So reasonable accommodation is a really good example of helping a very specific set of workers within our organization, and I don't think we've mastered that. I know we haven't really.
Happy to provide more information on that, and and I think it's also worthwhile to also revisit just the efficacy of some of the training that we're doing to date, because I do know one operational challenge a lot of our departments have is there's a huge number of required trainings, and then there's a whole number of other trainings that we try to do. And I think sometimes even just to make sure that we aren't having staff spending, a third to more of their time doing training, not able to dig into the work, we also need to think about what trainings have lost their value or really need to be revisited, not just continue to be adding to the existing set of trainings in addition to really also expanding training in key areas where we know we have opportunities to do much better than we are right now.
Yeah, that's a really thoughtful point. That's a really thoughtful point. And then the other is on what pattern, right? Because some trainings need to be refreshed and others, less often. So I think those are good points.
Supervisor Chavez, if I may.
Yes,
there
please.
is within the report, it does indicate a pilot that we're looking into, and that's the Intercultural Competency Coaching Pilot. And this is specific to giving one-on-one technical support guidance and navigation in being culturally competent. So that's part of kind of like what you're talking about in terms of providing that executive leadership support, small group support. That's a pilot that we're looking into because we also see that as a need to have that like personal one-on-one technical support and assistance.
That's really great. It's like, yeah, I think that's super important. Thank you for lifting that up. Something that's more tangential that I just wanted to offer is that I'm also interested in the staffing status at the gender clinic, because I know that's also an area that has touched on some concerns for folks. So I'd like to ask Supervisor Ellenberg if you can add to your motion that we get a report back in terms of staffing and utilization of the gender clinic over the last 12 months.
Sure.
Thank you. And that whatever report comes to us, and it also, if the chair is open at Health and Hospital, that it be heard there as well. And if we don't have time for written reports in October, if we could get it no later than November, would be great. All right, then we have a motion and I will reaffirm my second. And Dave, you want to vote us?
Vice Chairperson Ellenberg?
Yes.
Chairperson Chavez?
Yes.
Thank you.
Thanks very much. All right, so we're going to go on to item 10, and this is our schooling services. And then we're going to go to 18, our high priority initiative staffing, and then go back to the Welcoming Center.
Hi, good afternoon, Supervisor Chavez, Vice Chairperson Ellenberg. My name is Catherine Spears. I'm the Division Manager with Schooling Services. And also here with us today is County Office of Education. Dr. Powell, if you'd like to introduce yourself.
Good afternoon. My name is Dr. Sean Powell. I serve as the Executive Director of Youth Health and Wellness with the Santa Clara County Office of Education. Thank you for having me.
Thank you. Today we have a short presentation on updates to the schooling services, programs, projects, and collaboratives. Next slide, please. And next slide. We'll provide some updates regarding the family engagement, the SLS coordinator program. In FY22, we had served over 4,900 students and families and over 6,000 referrals were made to the SLS coordinators. In comparison from fiscal year 21 to 22, we saw an increase of the number of referrals by 4.9%, as well as an increase of the number of students served by 7.7%. And looking at the number of family engagement one-time activities that were held, we had 582 one-time activities, and over 45,000 students, families, and community members had attended these one-time events. We also had 132 family engagement workshop series and over 6,700 attendees. So in comparison to FY21, we saw a 67% increase in the number of activities that were held, as well as a 135% increase in the number of attendees. The SLS coordinators really focused on bringing students and families back onto school campuses and providing family engagement events throughout the fiscal and academic school year to really support the return back to school. The SLS coordinators' referrals were successfully closed at about 80%, and 1,886 students reported that their insurance type, and of those students, 68% were publicly insured. 51% continued to be, or the reason for referral was emotional well-being, whereas we saw about almost 10% of the students being referred was around school achievement. Next slide, please. So this is our data over time, looking at the number of youth and families served from FY18 to 22. And we see here, of course, the drop in students and families served during the pandemic in FY20, and now seeing a slow increase in FY22. Also, with a number of referrals submitted by the coordinator to the coordinators, again seeing a drop around in from FY20 to 21. And seeing a slight increase now coming up in FY22. The referrals have been successfully linked and have remained consistent for the past 3 years. That about over 70% of the referrals were successfully linked. Next slide, please. Here are some updates regarding our school-based behavioral health programs and crisis updates. So just to share, for the prevention and early intervention program that primarily does outreach, engagement, psychoeducation, parenting workshops, as well as skill streaming for students and early therapy. We saw year to date, 560 students were admitted to the program. We surveyed the teachers that were receiving skill streaming and found that 85% of teachers were satisfied with the services, the lessons being taught through skill streaming, and 85% of the teachers found that the services were helpful for their classroom needs. During the summer, the PEI program focused a lot on providing engagement activities as well as groups, specifically looking at regulation skills, building relationships, and practicing mindfulness. They did a lot of outdoor activities in the community, as well as like nature hikes, walks and activities in the parks, and at their local agency. The Schooling Services Behavioral Health Program and other outpatient level programs we served year to date, we admitted over 900 students, and we focused a lot of the work during the summer on social interaction, therapeutic services to reduce anxiety and depression, and also building skills. In our August or our last year, we had implemented a modified IFSP program at 2 school districts, Allen Rock Unified and Campbell Union School District. The program has been utilized more of a consultation to the school districts and providing support on specific cases. Since in FY22 Q4, there was 1 student that was admitted to the program following screening and getting connected to services. The mobile response stabilization services, in our report, we reported monthly updates to the number and % of calls coming in to MRSS from schools. And we also show that the Q4 calls, 78% of them were resulting into a safety plan, so they were able to discharge to the community, and 21% of the calls reported to additional crisis services. Looking at the MRSS program for the full fiscal year 22 in comparison to FY21, we did see an increase in total total in-person responses, referrals coming from the schools. And we saw about 105% increase from FY21 to FY22. Next slide. In expanding to school-based behavioral health programs, we have been working with the County Office of Ed and partnering with new school districts to expand the SLS Family Engagement Program, the SLS Coordinator Program. We have successfully executed agreements with Moreland, Los Gatos Union, Los Altos Union, and expanded into Orchard, Fremont Union High School, Milpitas, and Campbell Union High School. Our next steps for FY23 is to continue working with specific school districts, such as Evergreen and Los Gatos, Saratoga, and Palo Alto, to execute the service agreements to have an SLS coordinator on board. We have been able to execute agreements with Mountain View, Los Altos, County Office of Ed, and since the creation of this PowerPoint, we have been able to execute agreements with Cambrian and Loma Prieta school districts to implement an SLS coordinator at those school districts. We are also looking at the expansion of school-based behavioral health programs in FY23. This is to expand services to Moreland, Evergreen School District, as well as 2 additional school districts. We are also looking at expanding the PI supports and services across all school districts with the focus of providing universal prevention and early intervention services, such as parenting workshops and seminars, skill streaming presentations, psychoeducation, case management, and also to support any crisis needs regarding any community crisis occurrences. Next slide, please. And next slide. So updates to the Mental Health Student Services Act grant. This is in partnership with County Office of Education. They are taking the lead role in implementing wellness centers in school districts. Just recently, the County Office of Education, Behavioral Health were awarded additional $1.6 million to add to the $6 million funding that was already awarded to us. So we are able to extend the wellness center programs for an additional year. Over 691 students have visited one of the 6 wellness centers, and 82% of the students report they would return for future support. Dr. Powell, would you like to provide any updates to the MHSSA Wellness Center grant?
I would just add that we are really excited this year. In those 4 centers, we've been expanding our services and through establishing additional partnerships with community-based agencies to bring alternatives to talk-based therapy into the school site wellness centers, including music-based therapies, art-based therapies, and yoga-based therapies within the school site. We also continue to work with our student wellness advisory group, who continues to advocate for the expansion of school-based wellness centers throughout Santa Clara County, and is very active and engaged in civic engagement, meeting with local leaders and have upcoming engagements with our California School Boards Association to share about the work that they are doing at the local and state level as it relates to advocacy for school-based wellness centers. Thank you, Catherine.
Thank you, Dr. Powell. Next slide, please. The Student Behavioral Health Incentive Program, also known as SBHIP. This is a program under the Children, Youth, and Behavioral Health Initiative coming from the Department of Healthcare Services. We have been able to accelerate the program that was intended to start in calendar 2023, but accelerating the program as of June 1st to implement wellness centers in these schools listed there: George Leva at Evergreen Elementary, Milpitas High at Milpitas Unified, Cupertino High at Fremont Union High School District, Ohlone at San Jose Unified, Lakewood Elementary at Sunnyvale Elementary, and Elliott Elementary at Gilroy Unified School District. We are currently working in partnership with the County Office of Ed, Behavioral Health, and the 2 Medi-Cal managed care plans are gathering information to complete the needs assessment and submit to Department of Healthcare Services by the end of December. That needs assessment will include data gathering from all 3 work groups or 3 parties, as well as conducting focus groups, completing a resource map, identifying all of the behavioral health resources within the community and at the local educational agencies, as well as identifying additional information to identify future interventions. The needs assessment, focus groups and surveys, as well as the data gathering will continue for the remaining of the calendar year and submit to the Department of Healthcare Services by December 31st. And then in January, we will look at implementing additional interventions that has been identified, and we'll work with the managed care plans as well as the County Office of Behavioral Health to identify those interventions. Dr. Pell, any additional updates to the SB-HIP?
No, I would just expand upon just the needs assessment, just to indicate that the needs assessment is really a comprehensive assessment in which we are going to be engaging invested partners across the County of Santa Clara through what we're calling listening circles with caregivers, students, school and community-based behavioral health providers, as well as our educators within our schools. We'll be conducting county-wide focus groups as well as focus groups within the 6 districts that have been that are listed on the slide. In addition to that, we'll be conducting interviews across the county within various districts with both those within the 6 districts identified on the screen and other districts. Through that assessment, we're really going to be looking at not only wellness programs, but also things like data sharing and funding practices as we're thinking about sustainability of services and the overall behavioral health needs and infrastructure that will be needed in light of the policy changes that are coming down from both the California Department of Education and the Department of Healthcare Services. And then in addition to that, our resource mapping is also, we're really looking at this in a very comprehensive way, putting together maps that demonstrate school-based behavioral health services, the services provided to children and youth through the behavioral health department, and the behavioral health services that are provided through the managed care plans to young people throughout the county as well. So the overall assessment is quite comprehensive, and we're looking forward to what we learn from our invested partners to help guide us in identifying and implementing targeted interventions. Thanks, Catherine.
Thank you. Next slide. So just lastly, our next steps is to continue our work with expanding school-based behavioral health programming and the family engagement programming to new school districts. We are also looking at redesigning, piloting, and implementing school-based behavioral health programming to include mental health screening, parenting seminars, increasing skill streaming and skill streaming presentations, as well as increasing outreach. We'll complete the resource mapping that's countywide, as well as the needs assessment for the SB-HIP. Since completing this PowerPoint, we have already provided a presentation to SLS coordinators and navigators on just an overview of the managed care plans and the services provided through managed care. We did have a panel of managed care plans at the presentation to answer any questions about the from the SLS coordinators. So we are looking forward to our continued work with the managed care plans and giving more information to the SLS coordinators about those services. And also, since during that SLS resource training that we provided on September 9th that included the managed care plans, we also provided information around 988 and that rollout, as well as crisis support, grief support for students who may have lost a loved one to COVID, as well as LGBTQ services. And we look forward to having ongoing training, resource trainings throughout the year to help provide information to navigators and SLS coordinators and like on resources that we have in the county. That concludes our presentation. We're happy to answer any questions that you may have.
Thank you. I'm going to go to public comment first. And we're going to give each speaker 2 minutes. Thank you.
Next speaker is Tracy Windgrove. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
This is Tracy Windgrove. I'm the Director of Development at the Healthier Kids Foundation. The Healthier Kids Foundation appreciates the Santa Clara County Behaviors Health Vice Chair Ellenberg and Chair Supervisors Chavez's support of these programs. Healthier Kids Foundation has provided healthcare screening for 462 children in our first year with your support. That was 2 years ago. Last year, we were able to screen around 2,600 children. And this year, we plan on increasing the number of children screened for mental health screening to 4,600. We wanted to share with you just briefly that we have some feedback for mental health screening. We saw at least half of the students with borderline imminent need reported. And we reached out to those students with our parent advocates and have found care for those. And just wanted to share with you personally the fact that the county's support of mental health in schools really resonates me personally as well as professionally. We have had mental health issues affect our family personally, and I really advocate for the intervention with young people can have such a long-term impact. So thank you so much for your support of these programs.
Next speaker is Tiffany Tgmb. Forgive me if I mispronounced your last name. You have 2 minutes to speak. Please go ahead.
Hello, my name is Tiffany, and I am the program coordinator at Healthier Kids Foundation. I am here today to share a bit more about the My Health First program through Healthier Kids Foundation. Our program identifies students who have unmet emotional and mental health needs and work with their parents to get them the appropriate care. Using physicians, we screen students in the school setting, and it takes about 10 minutes per child. Depending on the student's responses, support may be offered right away or in the following days by a Healthier Kids Foundation parent advocate. Last year, 44% of the 2,598 kids we screened were identified with having unmet needs. 44%. Each of these students become a case for a parent advocate. Our team follows up with parents of these students to assist them in obtaining supportive services for their children and works closely with the established wellness centers to do so. They work with the student's parent in their preferred language and provide support in scheduling appointments and overcoming barriers to accessing behavioral health services or basic needs services. We recently spoke to a mother who had been supported in getting counseling service, and she shared that noticing that her son slowly opening up to her. She feels like the sessions with the therapist are working. Her son used to be afraid to communicate with her. He was always so nervous. She thinks Healthier Kids Foundation did an awesome job, and the program was a great experience for her. Thank you so much for your tremendous support of our programming.
Next speaker is Kathleen King. You have 2 minutes to speak. Please go ahead.
Hi, this is Kathleen King, CEO of Healthier Kids Foundation, and I can't thank you all enough for supporting this universal mental health program, screening program with 2,598 screened last year and probably 4,600 this year. It makes a huge difference to the families. We've found it's not just about the mental health, but it's so much other social work of food, rental assistance that our staff is helping the families with. It's been an amazing effort, and it's been a great partnership together. We are using Amy Reedy and Whitney Weber, some names you probably know from the past, and Laura Champion, to help us with continuous improvement. And we're excited that for every dollar that behavioral health has put in, we've raised another $1. So we are leveraging your funding by doubling it. And we want to thank Santa Clara Family Health Plan for their funding this year to allow us to also screen 6th graders as well as 5th graders. Thank you for having such a good staff. We love Catherine and her staff. We appreciate it. Thank you.
And that concludes our speakers.
Thank you very much. And that was a nice note for Catherine. So thank you. I want to see Supervisor Ellenberg. May I start with you on this?
Sure. Yeah, absolutely. Thank you to staff for the report. I want to review a couple of things. The youth mobile crisis service contracts were maintained at a 10% increase, but we heard really concerning stories last school year of really long delays for responses in some situations when the team was already responding in the field. And I just want to make sure I heard correctly. Did you say, Catherine, that there was a 105% increase in calls from FY21 to 2022?
Yes, that's correct. 105% increase for in-person responses, referrals by school.
And do we have any data about average response times for a call to MRSS?
The overall average wait time is about 37 minutes. It's not specific to the school responses, but we can look into that further if necessary.
Yeah, thanks. And tell me the 105% increase, what does that volume mean?
Sure, the volume looks like for FY21, sorry, let me just pull this up. For FY21, there were 236 in-person MRSS responses, calls from schools. And then in FY22 in total, there were 483.
Wow. This is a stunning level of increase that didn't come through in the ledge file. How is it working if we've more than doubled the year-over-year volume of calls, but we're only providing 10% more to the contract?
Celia?
Take that one. Good afternoon, supervisors. We actually have recently been working on our MHSA plan for the next 3 years and have made requests and recommendations to increase the contract for our mobile response and stabilization services. So we're looking to be able to add additional teams to be able to respond in a quicker fashion to those calls.
Yeah, are we tapping other MHSA resources in the 3-year planning effort or other strategies to be responsive more quickly to this finding? Clearly, there's a high demand for crisis response, but also for more prevention and early intervention to prevent the situations from developing into a crisis. And I'm feeling like concerned almost to the point of panic about scaling up this need more quickly beyond this 10% increase for contracted services on campuses. 30 more slots is good, but inadequate, clearly inadequate to meet the needs. So help me
for
with options. I hear the 3-year planning, but what can we do sooner?
We're also making a recommendation for mid-year adjustments for the mobile response. So we should be able to see that through and add additional funds for additional supports at mid-year.
And are there additional state funds that are available for this?
We recently added additional funds to those contracts through the Community Crisis Grant. And we were able to expand the age group for response up to the age of 21. So that was recent. Yeah, so we've been working really closely with the team to be able to improve the response time as well, because we understand the situation and the crisis that kids are in.
It's scary, and I know, and I hear you that the MHSA plan I know is in the public review stage. I really expect to see a robust effort to scale up PEI and youth mobile crisis services, certainly reflected when the annual update and 3-year plans come to the Board of Supervisors in December. And again, the 30 additional slots is a start. I know also that we're limited by workforce shortages, but I don't think I'm saying anything you don't know, that investing in this care and whatever workforce or supporting strategies are necessary to scale up is absolutely critical. So I'd like to see this addressed in both the next report to CFSC and at the December 13th full Board of Supervisors meeting. And to accommodate that, we may need to shift the CFSC quarterly update up to November rather than December, if that works for the chair.
Yeah, that makes total sense, actually, Susan.
Thanks. And Catherine and Zelia, again, here, my concern, certainly not directed at our staff, but I know that you are working extraordinarily hard. This situation just requires us to be super creative and move with every ounce of urgency that we can muster to find solutions here. Thanks.
Just as a follow-up, oh, Zelia, did you want to respond?
No, that's okay. Thank you.
Just as a follow-up, and maybe this is implied with what Supervisor Ellenberg is asking, but is this a staffing issue for the respondents? More than a financial issue.
Well, we're experiencing that across all of our programs in terms of how quickly our providers are able to staff up. So we do have many strategies that we're working on to put in place, but they're not quick enough to address, the need and fill the vacancies experienced throughout the entire system of care.
Supervisor, Susan, you had another thought on that?
I just wanted to clarify, do we know from our providers, it's a really good point. I mean, more money is not going to solve the problem if we don't have the workforce. Has Pacific Clinics or other partners said that they could ramp up more with more funding, or are they telling you that they don't have more people?
Well, I mean, that is our understanding, but how quickly they can hire, train, and get folks on board, it is an issue.
Well, and I think
they should be able to provide you with
that's
time estimates.
Exactly.
Just go ahead.
No, I'm glad you jumped in. That what I would, because there are kind of two issues there, Susan, that I wanted to just kind of ask the staff to detangle. One is the staffing issue today, and whether or not for programs like this that that require somebody to get in a car and move pretty quickly, whether or not we have found the right financial, sometimes for certain kinds of jobs, we have a slightly higher rate of pay. And one challenge that we've had with a lot of these positions is that we tend to get the less experienced folks doing this because it's on call. It's more, you're on call for so much time, and then you have to be within a certain area, within a certain amount of time and all of that. And I just would really reach out to them and ask them if their contracts are structured in a way that allow us to attract the right level of experience and talent. And Susan, the reason I'm raising this is that initially when the NCAT teams were being developed, there were two different problems. One was getting the right level of staffing on the public safety side. And then the other was getting people with experience that are willing to go out on swings and other things instead of having their clinic hours between 8 and 5. And now that the labor market's even tighter, I would just ask that we revisit that with the providers, because it's just something we should understand, because it may help us with recruitment. And I know I saw the beautiful behavioral health recruitment work you're doing with John Mills on the county side. But Supervisor Ellenberg, the reason I'm asking this question is since 80% of the services we provide in this department are external to us, I would like us to make sure that the learnings we're having on one side, that we're also taking a look at what may be necessary on the other side, just as a baseline.
Yeah, I agree. And the I don't like to call them non-traditional hours, but the outside of the standard working hours is a good point. But for the number of calls that are coming to our schools, those certainly are happening during the school day. And I wonder, are we at a level where the SLS coordinators are on site as part of our schooling services expansion, wellness center, all of the things we're looking at? We may be at a point where it makes financial and person power sense to have a professional who is assigned to a campus or several campuses that are in close range. For example, Trace, Hoover, and Lincoln are within a block of each other. And to really bring that in, I'm not pushing out our contracted providers, that's who we need, but maybe we find a way to regionalize the strategy to have people closer to where they need to be and greater numbers, at least when we're thinking about during the school day. I know homes are a little bit different.
Yeah, and I would just say, I know it terrifies them when we start to strategize on the dais about how they can deploy resources. You can see the look of consternation like across the board. So here's what I'm gonna request on behalf of us is, can we talk to our primary providers and have the conversation with them about what it would take to increase the response availability and therefore decrease the amount of time. I also, Supervisor Ellenberg, I'm just going to make an observation that I think a little bit of this, and I really appreciate it, is that our staff is getting the word out too. Like, I think that's helping the communication's really expanding. And one thing we haven't taken a look at, and I think it's something we're going to have to look at over maybe a series of 18 months, is whether or not these calls are calls that formerly would have been police calls that are now being diverted to, the right place, and so there's some complication in terms of the how people are accessing the services. And so I think what I would just ask is if you could work with Pacific Clinic, and I think Alum Rock is providing a similar service, to better understand the timing, the available resources, how long it really is taking us to respond on the campuses. I think, and being able to answer those same questions for home response. And then, it's something worth thinking about that through the district attorney, and I know the sheriff sit on the chiefs of police task force. And Susan, since you're the chair of our public safety committee, I think being able to look back now that 988 is coming on board, I mean, there are lots of things happening that may actually be impacting in a good way the calls for service, because maybe this is stuff we wouldn't have seen before. So
yeah, it's an excellent point.
And with mental health clubs on campus, kids are less afraid to talk to us. And so there may be a little bit of a silver lining in here, but better understanding it, I think what you're hearing Supervisor Ellenberg and I asking.
Yeah. All of those are great points. And I just wanted to make one last comment, because, we've been working closely with our provider around this and the issue of the staffing. The fact that they also got a recent rate increase to the contract, we're hoping that will support the training of folks that are, get ready to do this work, and hit the ground running.
Right. That's exactly what we want. I mean, it's, and that I know this was something that they raised a while ago. So I guess the other question is, how is on their end, how is that being implemented? Right. Because I think we don't tell them exactly what we want to do with the money, but we're asking them to meet the contract standards. So that'd be a good thing to check as well.
Thank you.
No, thank you both. And then Susan, was there anything else that you had on this item?
No, thank you.
I was sort of excited to hear how many kids actually went, not sort of very excited that went to the wellness centers. Like that's actually really good news. And, again, I know it's really difficult for us to measure stigma, but I wonder if any of our partners that are doing climate studies would know the answer to the stigma question. And Dr. Powell, I don't know if that's an area you all have already been looking at.
Yeah, that's a great question. I would say I want to highlight the data that we saw last year by also naming that our centers did not open until December, January. So we're not actually looking at a full school year's worth of data when we're looking at that number. We're really only looking at 5-6 months of the school year. And so I just want to contextualize the impact that we've seen the wellness centers have on students and that easy access. And then to the question related to climate, this is something that we are going to be looking at as part of the SBHIP needs assessment. We've actually requested climate data from the participating school districts, as we are not only looking at, I think from a school lens, we're not only but also climate.
I believe she is cutting out for everyone.
Okay, it's not
Yes.
just sorry.
Doing that work.
It's everybody.
All right, Dr. Powell, we sort of lost your last minute. I'm so sorry.
No, we can't hear you at all.
Yeah.
Can you hear me now?
Yeah, perfect. Go ahead.
Oh no, I was just saying, I think we are definitely looking at the behavioral health, but also the impact that wellness centers have on academics and engagement and schools feeling like places of belonging. And so as part of the SBHIP needs assessment that Catherine referenced earlier, we are looking at climate data for those schools, and we look forward to sharing what the findings are within that report.
Great. Good. Okay. Thank you. All right. So on that item, I think we're just going to want information to come back to us. And I also just want to say to Kathleen and the Healthier Kids Foundation, you know, I think one of the most important bodies of work is we've got to keep screening kids at, you know, at the younger ages and expand that. I think it's just critical. And I also think that what's exciting about it, and this kind of speaks to the stigma point we were just raising, if the parents accept this as a core part of their child's whole health at such a young age, I think it's just going to bode so much better for us longer term. So I'm just very encouraged by that and want to make sure we continue that partnership. So I don't think, do you all feel like you have what you need to come back, or do you need a motion?
I think we can come back in November is what I heard.
Yeah, I think that would be great with as much information as you have, and then we can sort of take it from there. Thank you.
Thank you.
All right. We're going to move on to item 18. And let me just see if this is a report from the Office of Children and Families Policy related to high priority initiatives and staffing updates. So.
Hey, thank you. Good afternoon, Chair Chavez, Vice Chair Ellenberg, Sarah Duffy, Chief Children's Officer. And I'm pleased to provide a status report from the Office of Children and Families Policy with brief updates on priority initiatives. And then I'll actually pass it over to Michael Garcia and Matthew Tinsley from the Santa Clara County Office of Education to review information on child care resource and referrals program and on child care availability and funding. So first, I'm excited to share we finally entered into a contract with a consultant to begin our study on the expansion of wellness centers. The Office of Children and Families Policy has been in regular planning meetings with staff from Behavioral Health Services and the County Office of Education, and we're ready to begin the study activities early next week. With regard to supports for children who have lost caregiver to COVID-19, significant outreach has occurred to share that grief counseling supports are available to children, youth, or young adults who have lost a parent to COVID-19, particularly in schools, now that school is back in session. So far, we've received 1 referral for counseling and service navigation support. First, 5 has begun work associated with 3 initiatives to increase the credentialed early care and education workforce and provide technical supports needed to keep family care providers in the field. The Office of Children, Family Policy and First 5 will return to this meeting in December 2022 with an update on the initial implementation and these initiatives. All reports so far is that it's off to a great start. In terms of billing and technical assistance training, a contract between Behavioral Health Services and the County Office of Education to support school districts in billing Medi-Cal is still on track to be executed in October, and the County Office of Education is ready to begin the trainings as soon as the contract is in place. And finally, in terms of staffing and work plan, our office has made an offer for a senior management analyst position, which has been accepted by a qualified candidate. So we will have analytic support starting anticipated in mid-October. So we're very excited about that. And our office is working to finalize vision statement for, as well as a detailed work plan outlining the priorities and projects for the year. And we will be back with that work plan at our October Office of Children and Families Policy Monthly Report. So those are the updates related to the office. And I will now introduce Michael Garcia, Director of Child Care Planning and Support with the Santa Clara County Office of Education, and Matthew Tinsley, Director of Strong Start with the County Office of Education. For context, at the April 28th CSFC meeting, there was a request for an update on the Santa Clara County Office of Education's resource and referral website with a focus on supports available to child care providers and families, as well as updates related to funding streams. So Michael and Matthew will present informational updates on these requests and be available to answer any questions when they are done. So I will turn it over to Michael, and Arcel, I believe, has the PowerPoint.
Thank you.
Yep.
We don't have the PowerPoint up in case.
Let's see.
It popped up for a moment.
Yes, I saw
Yes, just give me a second. I think I had a little bit of technical difficulties.
No problem.
Thank you, Arcel.
Okay, excuse me. Thank you, Arcel and Sarah. Good afternoon, Chair Chavez and Vice Chair Ellenberg, staff and members of the public. As Sarah's mentioned, my name is Michael Garcia, and I'm the Director of Child Care Planning and Support for the Santa Clara County Office of Education. Thank you for the opportunity to present on this agenda item. And again, as Sarah's mentioned, my colleague Matthew Tinsley and I will be presenting on the Child Care Resource Referral Program and updates to early learning and care. And if we can go to the next slide, Arcel. Thank you. The SCCOE is now going into year 3 of program operations as a resource referral, or R&R, for the county after having been awarded the R&R contract by the California Department of Education in July 2020. I'm happy to say that we've been building up our operations and modernizing our system, our functions as the R&R from year to year. And a big part of that, our program operations are based on the following bullet points you see here. So in terms of our R&R foundation, we maintain a child care referral database, also known as a child care parent portal, with all licensed child care facilities in the county. We help families find licensed child care program options that best meet their needs through various means of contact, which I'll outline in the next slide. We provide service referrals to families when other supports or services are requested. We help the child care provider community, prospective child care providers, navigate the licensing process. And we also provide training and other support services for child care providers in the community. Next slide, Arcel, thank you. And so this slide outlines, again, as I mentioned in bullet point 2, the slide shows you different ways in which we provide child care referrals. So going from left to right, you'll see our phone number, our email address, ways in which parents or caregivers can conduct a search on the county portal. You can do that either by making an account or not making an account. Parents can email or call providers that they're interested in, and parents or caregivers can also create a parent portal account to automate emails to providers and have that sort of interface if they so choose. Next slide, Arcel. This slide shows you the homepage or website of our R&R program at childcarescc.org. There you'll see the parent portal sort of on the bottom right hand, as well as other menu options related to resources for families and child care providers. And there's a QR code too to get you to that website as well. Next slide, thank you, Arcel. The next slide highlights ways in which the R&R website can be accessed in terms of language capacity. So you'll see a couple options there. The first is the drop-down menu and a scrolling header where the website user can select their language preference. Next slide. This slide shows you a sample of what the user sees once they click on their preferred language. I'd like to provide kudos to our County Office of Education's media and communications team, who, after we developed the website content, went back and translated each section of the website so that all content can be made available in both Spanish and Vietnamese. Next slide, thank you. Moving on, these next couple slides will show you the parent portal or childcare search function of the website with a sample interface both on a mobile device and a desktop. You'll see that the user is able to begin a search based on their search criteria. In addition to age, zip code, radius, multiple filters are also available. For example, type of childcare, family childcare center, schedules of care, and languages spoken by the provider. And again, this slide shows you the search results based on the criteria and just the geomap and a randomized list of childcare providers who have vacancies based on the search criteria. Next slide, Arcel. In addition to our R&R website and parent portal, we have an amazing R&R team housed at the County Office of Education, which consists of our resource and referral supervisor and resource and referral specialists. This slide shows you how those seeking childcare and childcare providers can contact and interact with the R&R staff. And so we have our, again, email address, our website, and phone number. Our hours of operation are Monday to Friday, 8 to 5 p.m. And our staff has language capabilities of English, Spanish, and Vietnamese. Finally, now that our program is 2 years old now, and to borrow an early learning term, we're in our infancy stage. My last slide outlines ways in which we promoted the County Office of Education in the past couple of years as the R&R for the county. And so you'll see here, we promoted through various social media outlets, flyer distribution with partner community agencies, most recently including our flyers in a Second Harvest Food Bank food distribution. Various daily newspapers and publications, webinars in partnership with our early learning enrollment campaign, and various ad space we've taken out in the last 2 years through these venues. And I'll pass it off to my colleague, Matt.
Good afternoon, supervisors, staff, and members of the public. My name is Matthew Tinsley. I am the director of the Strong Start Initiative at Santa Clara County Office of Education. And it's my privilege to provide you this afternoon with some updates on various topics of interest in the early learning and care field in Santa Clara County. Next slide, please, Arcel. So we're going to touch very briefly on these half dozen topics over the next sort of half dozen slides or so. Next slide, please, Arcel. So one of the things that's been happening over the county in the long term is a decline in the number of providers. And over the past 12 months, we've seen a continuation of that. We've seen approximately the same sort of 3% reduction in the number of centers and the number of family child care home providers over the last 12 months. So we have around about 2,000 or so licensed child care providers in Santa Clara County. About a third of them are operating out of centers. 2/3 of them operating out of private homes through family child care homes. When we take a look at the unmet need for care across all incomes, using estimates based on sort of the anticipated demand by age, what we can see is that we have pretty significant unmet need for care in children ages 0 to 3. So more than about 22,000 spaces we are estimating would need to be found in order to meet that unmet need. When we look at children ages 3 and 4, universal transitional kindergarten and the rollout of TK that is free and available to 4-year-olds right now, 4-year-olds who are 4 years and 7 months of age, but within the next couple of years to all 4-year-olds, is actually creating a fairly significant change in the supply of slots. And depending on various estimates that you make about the number of children who will enroll in transitional kindergarten and whether or not they are participating in other forms of childcare as well, it actually winds up looking like a fairly significant change in that distribution that's going to happen, that is happening right now and will continue to happen over the next couple of years. There's a research brief on the Strong Start website that explains sort of the assumptions behind this table and provides additional detail and information on where this estimate comes from. Next slide, please. There was a specific question around publicly funded early learning and care, and so we did some research reaching out to the county's early learning services department, which is the Head Start provider for Santa Clara County, as well as some information that we gathered from other sources on the direct contracted forms of care, state preschool and general child care, as well as the voucher-based care programs, CalWorks and the alternative payment program, to bring you these numbers, sort of the budget information and the number of children served. So for those first 5 lists, those are income and categorical eligibility-based programs, and they're serving about 13,500 children in Santa Clara County. And depending on their age range, for the direct programs, they're serving somewhere between 25 to 40% of eligible children, the preschool age children, and less than 10% of age eligible children for the 0 to 3 age programs. The final row is transitional kindergarten. Transitional kindergarten is part of the public education guarantee in California, and so it's essentially an entitlement. If the child arrives at a school, the school district is required to serve them and is reimbursed by the state on an ADA basis. We estimate, based on the population of 4-year-olds in Santa Clara County right now, that just shy of 9,000 children are eligible for transitional kindergarten as of the beginning of this school year. And that number will increase until by 2025-26, all 4-year-olds in Santa Clara County will be eligible for transitional kindergarten. Next slide, please. This year's state budget continues the recent trend of fairly significant changes in the ECE landscape across the state. The most significant of those is probably the ongoing rollout of universal transitional kindergarten. And obviously, as more and more 4-year-olds become eligible for transitional kindergarten, this creates some changes for the existing childcare providers. In particular, as more and more children become eligible for transitional kindergarten, we believe that more and more children will enroll in transitional kindergarten, which means that the other providers will likely need to enroll younger children in order to maintain their enrollment. Enrolling younger children comes with a whole host of changes, including reductions in capacity, increases in the number of staff required to serve children, training needs for those staff, and potentially even modifications to their facilities. This year's state budget also included categorical eligibility and enrollment mandates for children with exceptional needs in the state preschool program. Over the next few years, state preschool programs will be required to enroll more and more children with exceptional needs until eventually they'll be required to enroll 10% of their enrollment will have to be children with disabilities. That's again going to create challenges for providers. Providers will need training in inclusive practices, they'll need specialized equipment, and likely modifications to both their indoor and outdoor spaces. This is also likely to put some pressure on our early identification and referral systems to make sure that they are identifying and referring as many children as possible to the state preschool providers. One of the things that was included in this year's state budget was an option for school districts to hire preschool teachers who have a child development teacher permit to teach transitional kindergarten, so sort of a modification of the rules. And that would mean, or we anticipate that that means that existing preschool teachers will move to the K-12 school districts to teach transitional kindergarten because of higher wages, access to state retirement systems, and other benefits. In order to maintain then our preschool workforce, that's going to mean backfilling with either taking existing preschool staff and providing them with supports to get the units and child development permits they need to become preschool teachers, or alternatively bringing new people into the preschool field. So we anticipate that this will increase the workforce pipeline demand in preschool providers. And then finally, this year's state budget increases the income eligibility limit for state preschool to 100% of the state median income. So for a family of 4, last year's income threshold at 85% meant that a family of 4 would have to make a little bit under $90,000 a year in order to be eligible for state preschool. With the increase to 100% of the state median income, the new income threshold is around about $112,000 a year. So it's a fairly significant increase. What that means is that more children in our more children and more families in our county are going to be eligible to enroll in state preschool. Unfortunately, it doesn't necessarily mean that we'll receive more state preschool funding or more state preschool slots from the state. But in order to meet this demand, because slots are potentially available, but the providers will need more staff and they will need additional facilities in order to be able to house these children in the programs. And it is possible that the facilities may need to be in different places. There may be new neighborhoods where there will be sufficient concentrations of children to justify or to enroll and support a state program. And so this all sort of creates some changes to the local landscape that the providers are going to have to adjust to over the next couple of years. Next slide, please, Marcel. So one of the clear demands on providers is workforce. Just as you were hearing from behavioral health, there is an unmet demand for staff. It's very difficult for providers to find staff, but the state has created some additional funding streams to support training of additional early learning staff. The state's particularly focused on funding for training of new transitional kindergarten teachers. What we are estimating is that just based on the expansions that have come down in the last couple of years' state budget, we think that in order for the county to take advantage of all of those expansions and to use up all of those available slots, we'll probably need something on the order of 4,500 to 6,500 new professionals working in early care and education. The state has provided funding through various streams aimed at various different segments of the early learning workforce, but particularly focused on transitional kindergarten teachers, for around about 2,000 additional professionals. So in order to meet the workforce needs that sort of created by the expansion of the state programs, we think that we probably need to find supports for another sort of 2,500 to 5,000 early learning professionals in Santa Clara County over the next few years in order to be able to staff up all of these new slots. And that doesn't take into account things like turnover within the workforce or any efforts to expand to meet the unmet need that we discussed earlier. Next slide, please, Marcel. In addition to needs for additional workforce, these program expansions also create a need for additional facilities. And the state has provided some funding for these additional facilities. So in the last couple of years, the state has proposed about $700 million in new facilities for school districts to build classrooms for preschool programs, transitional programs, and to move more school districts from part-day to full-day kindergarten programs. The RFA from the state included sort of a scoring rubric that gave sort of significant points to school districts that are that meet the division of the state. I think it's the division of the state architect definition of financial hardship, and the percentage of children eligible for free and reduced price lunch. Based on those scoring criteria, we think it's pretty unlikely that school districts in Santa Clara County will be competitive for these grants. And we also believe that
So I'm sorry, your voice is fading.
Oh, I'm sorry.
Stay close to your mic. Thank you.
Okay, so we believe that the school districts in Santa Clara County are unlikely to be highly competitive for these grants based on the scoring criteria. And we also believe that there's likely to be a lot of demand from school districts for this funding. For the non-school district providers, the state has proposed two grant funding programs, a minor renovation and repair program where applications were due in March of this year, so last fiscal year, and a major renovation and new construction program. So that minor renovation program awarded up to $75,000 for family childcare homes and $250,000 for centers. The state originally budgeted $100 million for that program. They received requests for over $380 million worth of funding. And so in this year's state budget, they added another $100 million to the funding pool so that they could fund more of the March applicants. The state has proposed, I believe it's $150 million in the major renovation and construction grant program. They have yet to release the request for applications for that program. And with that, that is everything that I have. And so happy to answer any questions.
Thank you. That was both sobering and kind of exciting at the same time. Let me see if there are any members of the public that would like to speak.
We currently have no hands raised, Madam Chair.
Thank you. We'll close the public hearing and we'll come back to the board for comments and questions. Susan, did you want to jump in?
Sure. I'm gonna keep it limited to a very few questions. I know we're running quite long today, but just kind of overall, if we have so much unmet need, which we do, what happens when parents try to look for a place for their child on R&R? Are they routinely told, so sad, there's just nothing available?
So as our R&R staff receives calls and emails and other requests for childcare referrals, and if childcare subsidies or vouchers are requested, we do make those referrals to the providers, the state-funded childcare providers and voucher-based programs, and they more or less handle the enrollment. And depending on the income eligibility criteria and the prioritization, yeah, there is a waiting list for childcare subsidies in the county. And it's the programs that handle the enrollment staff handles that.
So is the wait list and the unmet need based on the shortage of actual spaces in the programs, or the vouchers for families that are at that eligibility level?
So our understanding is that firstly, there is a lack of providers, right? And what that means is that families wait for care. And many families, particularly with younger children, are waiting for literally years. We have a number of providers. So up until the last few years, the major constraint on providing subsidized care was a lack of funding coming down from the state. Over the last couple of years, the state has dramatically increased the number of slots that they are funding. And so now, for many providers, the constraint is not the lack of a slot, it's either the lack of staff to have in classrooms. For example, at the County Office of Education in our Early Learning Services Department, I think I heard yesterday, maybe the day before, that we have 35 open positions that we can't fill. And obviously, if we can't fill the position, we can't have children.
Right. So is is it it sounds like it's similar to our housing shortage where people have vouchers and know where to use them. We have families that could have or do have childcare vouchers, but cannot use them
Yes.
because they can't get a space. Okay, so it's good because we need to know exactly what problem we're trying to solve here.
Mhm.
For families, I know these are less the county's concern, but just so that I understand availability, for families that are paying whatever the market rate is, are they finding availability if they go to R&R or another resource? Are they finding spots, or are they also not finding them because of the provider shortage?
For the 4-fee sort of, I believe they are getting the referrals based on their search criteria. The providers on the parent portal are able to create their own account to cite their vacancies in a given week or month, and it real time provides that vacancy information for the user. So I don't think we're seeing that same issue with the 4-fee.
So are they competing for the same spots? If somebody can pay more, are they getting the spot above somebody with a voucher?
Yeah, I mean, I think what Susan's asking a really important question, which is what is happening on the ground? How long are the wait lists? And then if there is a vacancy and you have a mismatch, then what happens? Right. And one of the reasons that we were excited about, because either it was going to be you or I wanted the county to be the resource and referral, is so that we'd have this level of information, this level of interaction, so we'd understand how what the market demands were and whether or not we could be responsive to them.
Yeah.
So,
no, absolutely. So one of the problems, there is no centralized eligibility list. There is no centralized waiting list. So we do not know how many people, how long.
Right, Matthew, here's understanding that. Here's what the question is. You all are R&R. So while it's not everything, it's a slice of the apple that we're asking about, right? And so for your slice of the apple, what are we learning from that experience in a bunch of different ways? How long's the waiting list? The question that Susan asked about if you have a mismatch, what happens to that slot? So as an example, in behavioral health, we buy a certain number of beds. If we can't fill those beds, another county can come in and use one of those beds, or certain criteria and triggers depending on the contract. So that's really what she's trying to ask in terms of what's within your purview.
I'm going to defer to Michael as our lead.
Sure. So I think with the voucher-based programs, the alternative payment programs, the family who qualifies for the voucher, the alternative payment providers refer them to the R&R to assist in the childcare search. From there, the parent does make their selection and brings that back to the alternative payment program to issue the voucher. In terms of waiting lists and the prioritization, that's really the family and the alternate payment provider that handles, I guess, the prioritization of the waiting lists of the issued vouchers. There's also direct service state-funded state preschool and center-based programs who are not voucher programs, but run the state preschools and center-based. And so they have all various waiting lists as well, again, based on income eligibility and prioritization as issued or provided guidance by the state. And as Matthew said, there isn't a centralized waiting list in the county. So I think we can connect with our state-funded providers to get a handle on what their waiting lists are and the timelines on issuing vouchers and so forth, and can bring that back if that's of interest.
It is of interest, and why don't you go ahead and bring that back? And Supervisor Ellenberg, I'm sorry that on this item, I know it's of such big interest to both of us. But we have one more item on the agenda that I'd like to keep you for. So I'm going to wrap this up. I'm going to say thank you to all of you for the report out. And, if you don't mind, Supervisor Ellenberg, giving some thought to how, so first of all, the information we requested, we'd love to have come back. And perhaps, Sarah, you can work with Michael and Matthew to figure out how to bring that back before the December timeframe.
Absolutely.
Okay, great. Susan, you good with that?
Absolutely.
Okay, great. Thanks. Thank you very much. Thank you for all the information. We're going to go to item 11, and this is our welcoming center. And then we have a few verbal reports. So I apologize for our team that waited to be last on our list today. Welcome.
Good afternoon, Chairperson Chavez and Vice Chair Ellenberg. And really to start, in consideration of time, I wanted to check if you wanted us to run through the full presentation or if we wanted to jump to questions.
I'm comfortable with questions. Susan, are you?
Absolutely.
Okay, and thank you very much for the report. It actually left me with only a couple of questions. Let me see if there's anybody from the public who would like to speak on this item.
We have no hands raised, Madam Chair.
Thank you so much. We're going to close the public hearing and come back to the board. Susan, did you want to start?
Sure. I did have a few questions, but in the interest of time, I'm going to ask Dan if you would follow up with my staff after the meeting on a few specific elements in today's report. I just want to point out one critical piece right now, and I'm going to quote a little bit from the ledge file. It states that stakeholders also highlighted a need for more accurate and honest information sharing as a means of supporting appropriate decision-making, preparedness, and aligning expectations. I absolutely recognize that sharing information around family history or a case plan may be inappropriate to share with the potential prospective foster family. But I really worry about the wording of the statement indicating that stakeholders feel that they're not getting an honest account of information and that they're not getting information to support, again, quoting, decision-making and preparedness, which I presume to mean relevant to providing care for a child that's placed in their care. So I'd like to ask the department to continue to dig into this stakeholder feedback and provide an update in the next quarterly update on strategies to improve staff and caregiver communications in the broadest way possible. And just, to highlight when GFCS is delivering a child to a prospective foster home, without getting into confidential information, we need them to trust us that we are telling them as much as possible and whatever is necessary for them to appropriately care for the child that's coming into their care.
Absolutely, Supervisor. And I think this also aligns with the importance for engaging relatives in the process as well. So when we're looking at placement options, pulling in relatives and people known to the child.
Somebody that already knows the child, that's great. But when that's not possible, we still have to think about how we are building trust and sharing information so that the placement can be as successful as possible.
Absolutely. We can address that in the next report.
Thanks, Dan.
Dan, thank you. The thing I wanted to add was that I didn't see the work plan for transition. If in fact the staff is still looking at transitioning, could that come back to us before December?
Yes, Supervisor. We can send something back before the next date.
That would be really great. And then, and I do just want to emphasize a point that Susan raised. I think that was something that was a little bit concerning, and I recognize that the department's constantly going through a process of re-engagement and especially with new families, and frankly, some families that have had more challenging experiences with us. So I do want to just emphasize Susan's point and just support her in getting that all of us get that kind of information back to better understand that.
Yep, absolutely. And I think this is unfortunately a challenge that's kind of faced foster care systems for a while. It's knowing kind of what we know when we have to remove a child, and then being able to have that information readily available to those substitute caregivers to make sure they're providing the best care possible.
Yeah, I know. And if there are needs around technology or other things, that would be just important for us to know.
Okay.
Thank you. All right, with that, we're going to move on to item 19. And this is a report out of our Chief Probation Officer. Laura's still with us. Hey, Laura, welcome.
Hello, I am indeed still here. It was a good meeting, a lot of information. So I have two announcements. One that I just thought you guys would be interested in, our Youth Advisory Council that's at the ranch. We have one for out of custody and then one at the ranch and one starting in juvenile hall. They participated in a COE board meeting yesterday. County Office of Education board meeting yesterday, so not on camera, but they did participate. So that's like really cool.
Yeah,
and then on, oh shoot, what did I just do with the type? On October 19th from 10 to noon at the Juvenile Hall Gymnasium, we're doing a meet and greet for resource providers and staff because it's been a long time with COVID and we have a bunch of new people.
So they can all see each other,
Yeah.
not that Stanley world.
In real life, yeah.
That's awesome.
And that's all I have.
How many more meetings do we have, you, Laura?
I don't know. It hasn't been posted yet, so
okay.
I guess.
Good. Well, I'm glad that you're still with us. All right. Susan, did you have any questions?
I didn't. Thanks, Chief, for the report.
Thank you, Laura. All right. I think, great, Deborah.
Good afternoon, trying to be on time.
You're there.
Just a few notes, just to say that we're continuing to have our meetings with our labor management partners on the implementation of CalSAWS. We'll start training in October to December. We've reported that earlier. That's that major system change, and we'll keep you abreast as we continue to go through the implementation process. Second, as we all know, I'm sure you heard, Care Court legislation was signed. Santa Clara County will be in phase 2, which means we'll have to implement in October 2024. So we're getting to have conversations with some of the key stakeholders around how we pull together a collaboration around how to develop that plan. So to let you know that, so you'll be hearing more of that. Good news is our CalFresh customers got an increase, a cost of living adjustment, and because inflation has been really high, they got a significant increase. And just to give you an example, for a family of 4, previously to October 1st, they got $835 a month. It will be increased to $939 a month. So for families, when you go to the grocery store, that makes a big difference for them. And some more good news, we had a successful, I'm sorry Daniel left, he had a successful family reunification day. We celebrated the success of 5 families who were successfully reunified and were part of the care team that worked with the social workers and Paper Health and everyone else to have their children return and to continue their success route. So that's it for us. And thank you so much for the opportunity to share the information.
Thank you, Deborah. Deborah, one question for the county, on the county side for Care Court, the lead agency is SSA.
Well, we're still trying to figure that out. That's a good question. We're trying to figure it out from the state on, is it the court? Is it us? Is it combination of Sourcewise and the Silicon Valley Living Service Center? So that's why we're going to host a meeting and bring some of the key partners together to kind of figure that out. And we'll be working with county council to get some clarification on that.
So what I would like to request is, and I think this is something that the full board would need an update on, is if we could get an update from, and I know that Greta has left, but from Dr. Smith, Deborah, through you to the entire board about the implementation team. And I would just want to recommend that we have behavioral health and, Curtis Ohashi and from our Paul's team, the medical team, and whoever, obviously whoever they think is appropriate, but the folks who've been working at the more integrated service level, I think is them, and Greta should be involved in it. And the reason is that there's a lot of work, as you know, being done to build out the infrastructure for support services on the behavioral health side. But you have the folks who do the conservatorship on your side. EPA, everything is so split. So I don't have a preference about the lead agency. I do have a preference that all of the players are at the table. early, and that the report out is assigned to a committee, which I'm gonna adopt us unless the board gives us another alternative.
Oh.
So again, that'll be through Greta. Deborah, if you wouldn't mind just presenting that to her.
Oh, absolutely.
You don't,
No
and
problem. That's a great idea. Thank you so
Consuelo
much.
should be part of that.
Oh, absolutely. And
Great,
OHS,
yeah.
Office of Supportive Housing.
Oh,
And frankly,
absolutely.
yeah, that's like, it's kind of a key Greta combo. So yes, I think that's right. So if you all could just let us know, and off agenda before the next Children's Family Seniors Committee, just in terms of the frame up would be great.
Okay, absolutely. And we'll have that conversation with Greta. Thank you so much.
Good, thank you. All right, Ignacio, you were bringing us home here.
Thank you very much. I just wanted to give an update on 2 legislative proposals that are in the process of being developed through our state association, through the Child Support Directors Association. I'm just going to give a very high level overview of each just to inform the committee. These are still in the development stages, but every year our association puts together a legislative platform, and these were 2 areas that were identified as being a significant potential benefit for the program statewide. The first has to do with amending the California probate code. The current code section states that within 90 days of the issuance of letters of administration to a personal rep of an estate, the executor or the attorney must provide notices to 3 California state departments of the pending probate case. Those 3 state departments are the Franchise Tax Board, the State Department of Healthcare Services, and the Victims' Compensation Board. Our potential legislative proposal is to include the Department of Child Support Services, the State Department of Child Support, so that we're able to receive special notice related to any pending probates. The reason for that is that it would allow us to review for any potential claims or to seek a potential levy regarding any potential distribution of funds related to that pending probate action for anyone that owes child support. Up until now, the process has been manual, and we really rely heavily on the word of mouth from the person who's receiving child support. Oftentimes it's the mother or other family members to notify us that there's an actual pending probate case. This would actually codify this and would allow State Department of Child Support to notify us of any pending probate action. So there's a potential there to really benefit us and a potential to benefit families if we're aware of any probate actions that may potentially yield any types of collections for any past due child support. So that's one. The second one has to do with workers of the gig economy. Currently, we receive an automatic interface for the Employment Development Department through the state for income earnings information on anyone who owes child support, anyone who we have a case against for child support. That information comes in automatically through our system, and it's updated through an interface. And we use that information to determine if the person is working, whether or not they're earning the same level that they were when we established the court order for child support, whether there's a modification that needs to be done, and so on. Workers in the gig economy have not historically had to report earnings to EDD. So we're looking at putting together a legislative proposal that would actually have workers report information to EDD and then have that information be part of the interface that we receive on an automatic basis, so that we could use that information in order to really make it more efficient and effective to establish any potential child support judgments, and more importantly, collect on any child support debt that is owed to the families and children on our caseload. So those are 2 legislative proposals. They're still in the works. I'm going to be working with the county as well to get their input on any of these 2 legislative proposals, and also with our state association, but potentially a couple of areas where we really could use some help, and we may see some progress depending on where this moves forward. So as the proposals move forward, I'll make sure I keep the committee appraised of any updates. And that concludes my report.
Thank you, Ignacio, and thanks for pursuing those lines of inquiry. I think those are going to be very important. Well, thank you, everyone. This concludes our meeting. We will see each other on October 27th. Thank you all. Thanks.
Recording stopped.